wanted to talk a minute or two about the utility of limited field cone beam scan that was utilized for this particular patient. Patient had been referred for extraction and implant of tooth number 2 due to failed endodontic treatment. The failure, the endodontic treatment, was due to a missed canal. It was not instrumented properly and could not get accessed due to significant calcification. And you can see that this particular root, the palatal root, had a canal that was not obturated and instrumented properly. The patient had subsequently been referred for the tooth to be extracted, and that's tooth number 2. Following extraction of tooth number 2, this is a pre-treatment tooth number 2. After the tooth was extracted, this is the immediate post-op of the extraction. We can look at tooth number 3, which appears on the periapical to be well instrumented. It was also done by an endodontist, and the patient had followed up with me for a CAT scan 3 months after tooth number 2 was extracted. And the CAT scan image, which shows here, shows my approximate location of the implant along with the adjacent anatomy. And this is a limited field view of 5 by 5 centimeters. Reduced exposure, reduced radiation. And if we take a look here at the cross-sectional view, interesting finding that shows just how useful a cone beam can be in treatment planning cases. The white area outlined here represents the optimal position of the implant. This particular treatment plan for a simultaneous sinus lift, internal sinus lift, to ensure adequate bone around the implant. But upon examination of the limited field view CT image, we can appreciate the fact that there is a significant radiolucency and some mucosal thickening at the apex of the mesiobuccal area of tooth number 3. And it was interesting because the periapical image that shows up here does not demonstrate any significant radiographic pathology because there's a little bit too much overlap here. Everything looks within normal. The cone beam image shows pretty clearly here how not only was a canal missed, a mesiobuccal, second mesiobuccal canal, but there is communication into the sinus floor from this tooth that was not instrumented completely. And this is an additional cross-sectional image, and as we rotate through, can appreciate the fact that the canal was not instrumented here and the lesion presents itself right under the floor of the sinus, right at this location. Slight change in the positioning of the slice here at an angle shows when I rotate through the mesiobuccal, you can see just the apex of this, and this is actually a low resolution scan at 200 microns. So the utility of the cone beam is important both from implant planning as well as diagnostic. Thank you.